to do is do.
Less than $20.
Okay, good evening, everyone. I want to welcome everybody to the North Carolina Global Sunday Evening Call. Before we get started, we are going to demonstrate how we do the company motto. I will say company motto, are you ready? You'll raise a fist and say yes. I will say go. We'll say cherish the spirit, create the vision, follow the faith, serve in humility, aja, aja, aja. Okay. All right, everybody unmute. Everybody unmute. Good to see you, Jake. All right, everybody unmute. All right, company motto. Are you ready?
Yes.
Go.
Cherish the spirit, create the vision. Follow the faith, serving humility.
All right, all right. Okay, all right. Want everybody to mute yourself. Once again, we want to say good evening to everyone and welcome each and every one of you to our Sunday evening North Carolina Global Call. Tonight, we have a very special speaker. He is definitely one of our favorites, also known as the favorite doctor in Atomy. Ladies and gentlemen, let's give a warm welcome to Diamond Master, Dr. Sway. All right. Also, he is, for your information, doctor of Oriental medicine and also acupuncture. All right.
Oops. I mute you.
Oh, okay. Was I talking too much?
No, I didn't know how to mute yourself, mute everybody, and then somehow I mute you too. No, but you can talk.
Okay, yeah. Just in case you all did not get the introduction, Dr. Sway is a doctor of Oriental medicine, also acupuncture and some other things. And I'll give him the opportunity to share with us because we always have new people to let us know, Dr. Sway, some of the other things that you specialize in.
Okay, hello everybody. My name is Aaron Sway. I practice Oriental medicine. It's been almost 30 years now. I think I practiced for too long, but I still practice. My specialty, I started with pain management. And then I was interested in dermatology. And so I specialize in TCM dermatology, traditional Chinese medicine dermatology. And some of the skin issues people are having hard time to treat. In Western medicine, there are not many treatments available other than antibiotics and the steroid. And somehow Chinese herbal medicine could help a lot of skin conditions. So today we're not going to talk about the skin. I am going to talk about the treatments and healing today. Well, one thing that I don't enjoy is I talk to myself. When there is no response, I feel like I'm talking to myself. That's fine. I am going to share my screen. Okay, and
We can see it.
yeah. Oh, like that. Okay, treatments and healing. I like to identify what are the treatments and how the healing are take place in medicine and in our body. So sometimes we are a little confused with the treatments and the healing. The healing takes place in our body, and the body is heal itself. The treatments are to help our body to overcome some of the anxieties, and also it shortens the healing time. So there are the treatments, and the treatments are absolutely necessary to help healing. However, we have to understand that healing is based on our body's immunity. Okay. Okay, so the treatments is something that healthcare providers do for their patients to control a health problem and lessens its symptoms or clear it up. Treatments can include medicine, therapy, surgery, or other approaches. A cure is when a treatment makes a health problem go away and it's not expected to come back. However, as you know, our body is limited in time. We're not live forever. At some point, we all die. And but this cure, sometimes we don't see often. However, when our the condition, the health condition got better, and sometimes we don't see the problem again before we die. So that's called cure. Okay, and there are three types of treatments, and the first one is curative. That means to cure a patient of an illness. And the second one is palliative. That's to relieve the symptoms from an illness. So something like a pain medication will relieve some of the symptoms. And also if somebody has insomnia, that can relieve some the sleeping issues and so on, okay? And preventive is to avoid the onset of an illness. And the preventive can be diet or exercise, and also some other types of therapies. So therapies, as you know, there are many types of therapies. I think there are like almost 100 type of therapies. So the therapies that we know is physical therapy. Everybody knows about the physical therapy, occupational therapy, respiratory therapy, speech therapy, psychotherapy, nutritional therapy. And like I said, there are more than like 100 type of therapies. And the healing can happen even when the condition is still there. So, you know, we are expecting to have a cure, and we feel there are still symptoms exist. That doesn't mean that the healing is not happening. The healing is still happening while the condition is still there. So we have to learn to be patient, you know, and help the body to enhance the healing. So while treatment is in form of medication or therapy can help a person manage their mental health, the acceptance of change. So, you know, sometimes, you know, we are in hurry or we are anxious of, you know, the symptoms go away right away, right after we take some medicine or, you know, even the surgery, you know, and some therapies. But we have to be patient because the body has its own time frame to be healed and or cured. So so during this process, the acceptance of change or changes are very important because the body changes all the time. Sometimes response to your medications or therapy, the body, your feeling will change sometimes every day or every moment. And the healing is still happening. So we have to be patient. And especially with supplements, some people are very impatient, after take a supplement just a couple days and, ask why I'm not feeling anything better. So we have to be patient. And there is a nutritional therapy. I like to go over with about this nutritional therapy because we like to step on somebody's foot, and that is a nutritional therapist. They're the dietitians. They're licensed in Georgia and in North Carolina and most of states, and they are specialized in your diet. And so we like to, tell people, take this, take that, eat this, they eat that, just like, we are dietitians. And if we are really like to give advice, there are licensed dietitians. So, when we give advice, we have to be careful, even nutritional, the recommendations. And there are other types of medicine other than conventional medicine. They start to call alternative medicine, complementary medicine, and they are not in the mainstream. However, they were used to be in the mainstream of the medicine before conventional medicine. Something like meditation, mindfulness, hypnotherapy, massage manipulation, mind-body medicine, alternative medical, the medicine like herbal medicine, energy medicine like acupuncture, acupressure, and biologically based therapies like a diet and the supplements. And before we have this conventional medicine, really the surgeries and hospitals and so on. Actually, these were conventional medicine. Now they become alternative medicine. And the alternative medicine, as I told you, there probably a lot of people are practicing this medicine nowadays. The herbs, dietary supplements, yoga, meditation, energy healing, Reiki or Qigong, the foot massage, reflexology massage, and so on. Oops. Come back. Okay, so what we can do, what we can do in terms of multi-level marketers, we cannot diagnose, or we cannot treat, or we cannot cure. We cannot recommend dietary nutrition. Then what we can do, we can tell the fact. Something, it's common sense. Something like the clinical studies have shown that high dose of vitamin B6 that can help anxiety and depression. You see? So you're borrowing the clinical studies and you can tell the fact. So the vitamin B6 is very important. Studies have shown that the anxiety and the depression are related to vitamin B6 deficiency. So if you supplement with the B6, a lot of people are feeling better. I have this young lady patient who came since she was junior high. And she was in the gymnastic or the dancing group, I think. And she sprained her ankle. And so her mother brought her to me, and she's been treated since then. And then she had lots of other issues. And then she graduated from high school. She went to college. And after about a year, she had to come back because of depression and anxiety. And she also had the dysmenorrhea, amenorrhea, no menstrual cycle for like 6 months, and her lower abdominal become very hard, and she had some of the physical issues, and the most issue was the mood problem. She didn't feel good, and she didn't want to go out, and she didn't want to meet anybody, and she was isolated. She cried, and and then she came back. So her mother sent her to my clinic, and I saw her. And I started to treat her. And one of the supplement that I recommended was vitamin B complex from Atomy. And I saw her a couple of weeks ago. She was ready to go back to school, and she was a different person. I won't say vitamin B complex was the main treatment or that helped her. But her mother told me that vitamin B complex really helped her. Okay, what Atomy healthcare products have vitamin B6? So we are going to go over what Atomy healthcare products have vitamin B6. Believe or not, there are many Atomy products have vitamin B6. Okay, first one is noni juice. So noni juice has 7 types of minerals, 18 types of amino acids, 12 types of vitamins. And among all the vitamins, it has a vitamin, the B6. And this noni juice I shared with the Atomy partners in one-day seminar and also Success Academy. And noni juice is a phytochemical. That means it has almost the complete nutrients in one fruit. And once it's fermented, it also produces lots of probiotics. So I start taking this early in the morning before I drink anything. I take this 4 to 5 ounces of noni juice, and then I drink yin yang water. So everybody knows about the yin yang water, half cup of hot boiled water mixed with a half cup of ice water or cold water. And that's called yin yang water to balance yin yang, yin or yang in our body. And the noni juice, since it has, so complete the minerals and the amino acids and the vitamins, somehow this noni juice could help a lot of health issues. and it can enhance the healing process, which means reduce the healing time. Okay. And the second one is hemohim. Did you know hemohim has a vitamin B6 in it? Let's look. B6 right here, 12%. So the hemohim, you can see it has a vitamin C, thiamine. That's another, the vitamin B, B1, I think, and riboflavin, that's another B, and the pantothenic acid, that's another B. So there are so many B vitamins in hemohim also. The third one is rhodiola milk thistle. Did you know rhodiola milk thistle also has a vitamin B6? So rhodiola milk thistle is adaptogens. That means it helps to adjust our mood. That's adaptogens. There are other types of herbs are adaptogens, and rhodiola is one of them. And as you all know, this supplement could help your liver and detox the liver. And liver has something called glutathione, that is the peptide produced in the liver. This peptide is very important to help our physical endurance and also detox the body. The glutathione is a master of antioxidant in our body. That means it helps our body to fight free radicals. So if we have too many free radicals, they start to damage our DNA. That means we're prone to have many of the diseases, such as cancer. Okay, it will mutate our own cells to become cancer cells because of the free radicals. So in order to prevent, we have to take lots of fresh fruits, vegetables, high the antioxidants like blueberries, and some other high antioxidant fruits and the vegetables. So rhodiola milk thistle, it can also help our stress. Okay, so this is the formula we have. Vitamin B complex. This is the complete B complex, and the most of B vitamins actually they are from the animal products. However, this B complex has lots of organic fruits and the vegetables. So as you can see, if anybody are not eating fruits and the vegetables in their diets, and your kids don't eat vegetables, your husband don't eat vegetables, only meat, then you should recommend this, because the B vitamins are coenzymes. That means it will convert your nutrients into energy. It's very important. So if you see Atomy vitamin B complex energy and metabolism, okay, it will enhance your metabolism also, and produce more energy. And sometimes I don't recommend this to people who like to lose weight, especially when people have large appetite. Because somehow I found out when I take this, I tend to eat more because I have better taste of food. So if anybody has like a poor appetite and don't like to eat and don't have the good taste, then I recommend to take vitamin B complex. Okay, so vegetarians at risk for B deficiency because, like I said, lots of B vitamins are from the animal products. So according to studies and research, a strict vegetarian diet that forbids the consumption of any animal products might cause a vitamin B12 shortage as well as a heart disease. And B12 is very important because B12, if you're deficient, a lot of patients feel extreme tiredness, fatigue, chronic fatigue syndrome, lack of energy, breathlessness, shortness of breath, feeling faint, feel like anemic, headaches, pale skin, noticeable heartbeat, meaning palpitation. All of a sudden you feel like you're running 100 miles per hour. Your heartbeat beats very fast. And the last one, look at this carefully, tinnitus. The tinnitus is something that a lot of people start to complain. Used to be all the old people are complaining tinnitus, ringing in the ear. But now there are a lot of young people are also complaining the tinnitus, hearing sounds coming from inside of the body, not from outside, not the noise from outside. You hear the noise constant. And sometimes when you are, calm and, at night, you hear the noise in your ear. So that's the tinnitus. And I also noticed that after the COVID, whoever, got the COVID, after they all recovered, that they still have the tinnitus left. Okay. So vitamin B deficiency. Okay. And the last one about the B6, or complete B6 or complete B vitamin. This is another, the formula, it's almost like noni juice. If you look, it's 18 types of amino acids, 15 types of fatty acids, 13 types of minerals, 12 types of vitamins, 5 types of antioxidants. Wow, it sounds like a more complete than the noni juice. However, it doesn't have what? This doesn't have probiotics like noni juice. So noni juice, through the fermentation process, noni juice produces probiotics naturally. And this spirulina is not fermented, therefore there is no the probiotics in it. Anyway, but if this is another phytochemical, that means just one ingredient. It has almost like a medicine. If you concentrate this, it could become a medicine. So when you talk to people, when people say, "Oh, I have cancer," then you have to be alarmed because you don't want to be tempted to say, "Oh, there's a formula to help your cancer." So we don't want to make that mistake. However, we could ask, or if they say, "Oh, I have muscle spasms in my calf muscle at night," then you can say, "Oh, really? There is a formula that could help you." Then it's okay. But you don't say directly, "Oh, this formula can help your cancer," or help your diabetes, or help your hypertension. We don't say that, right? So the symptoms, we are more of the symptom oriented, and we need to be good listener and be patient and don't jump into the conclusion and telling them, chemohim can help you. No. So the spasms, I'm sure once in your lifetime, we all experience at least once the muscle spasm, that will wake you up. Like, you have a spasm in your calf, just feel like you don't know what to do with it. So what can help muscle spasms? The spasms, muscle spasms are twitches, tremors, and the muscle cramps are sign of magnesium deficiency. Okay, so we have magnesium in our product. Where is the magnesium in our product? In worst case scenario, deficiency may even cause seizure and or convulsion. Sometimes when your muscle spasm is so severe, you feel like you cannot move, right? You feel like your body is like a stone, like a seizure. The scientists believe these symptoms are caused by a greater flow of calcium into nerve cells, which overexcites or overstimulates the muscle nerves. Wow. So it's too much of calcium. It's not too much of calcium. It's an imbalanced calcium. Okay. So too much of calcium supposed to be deposited into your bone. That's the savings or your checking account in your body to deposit your flow of calcium. However, if the calcium is not deposited into your bone, it just flowed in your bloodstreams, that can become imbalanced. So how do you balance this? You balance with the magnesium. That's why 2-to-1 ratio is most recommended between calcium and the magnesium. So we have this product. It's called Atomy Calcium. Plant-based calcium. It has a perfect 2-to-1 ratio. Okay, and also have other vitamins like a vitamin D and vitamin K. Why vitamin D? Because you need vitamin D to absorb calcium into your body, especially into your bone. And why vitamin K? Because you don't want to calcify your blood vessels. So if we calcify our blood vessels, we have problem. Calcification of the heart or the blood vessel, that is also as serious as you have too much cholesterol in your bloodstream. So in order to make your blood vessels soft, we need to have balanced calcium and magnesium. Constipation and bloating. So if somebody say schizophrenia patient, to be extreme, right? Those patients are taking very serious medications like, I forgot the name. Anyway, they take a very, heavy duty medication. And a lot of times they have a constipation. So the constipation could make them feel very heavy and bloated, and they feel very angry. And I had a patient a long time ago, 30 years ago. He had schizophrenia. That's when I was still a student in Oriental Medical School. And I just learned about this formula, not really to treat schizophrenia, but the professor mentioned something about this formula could help psych patients. And so I did the research and I saw this patient from the referral, and I asked the patient if he has constipation, and he said yes. So, and he doesn't go to the bathroom. He only goes like once a week, or sometimes even once a month. Guess what? His belly was very big, and so I used the formula to move his bowel. And so I gave the formula, and after he moved the bowel, his parents noticed the difference. He become a different person. So if you don't move your bowel every day, it's not optional. You see, you have to manage yourself to go every day. And some patients doesn't want to admit that it's the problem. They all say, oh, I born with it. They born to have the bowel movement every once in a while. You don't want to negotiate with yourself, or you don't want to comfort yourself that it's okay. No, it's not okay. Garbage in, garbage out. If you don't go every day, that's no. So this is what I created. This is Atomy's Gas X formula. You can put everything together and make a drink, and you can drink at once. That is the probiotics, psyllium husk, and the Atomy and Feinzyme. You can put everything together, shake it, drink it. And it depends on your condition. You can put 2 of probiotics, 2 psyllium husk, 2 Feinzyme. Okay? Then make sure you go every day. And this is how you manage. And believe it or not, if you do this, your poop doesn't smell bad. You don't have to worry after you have, after 1 week of, no bowel movement. If it's 1 week of no bowel movement, you don't want to go into that bathroom because it will smell, it can faint. So, Hippocrates, he said healing is a matter of time. So be patient, but it is sometimes also a matter of opportunity. What's that mean? So I did a little meditation on this phrase. It is sometimes also a matter of opportunity. What kind of opportunity did he talk about? Opportunity of knowing yourself, and your opportunity of knowing your body. You see, when the healing is still ongoing, it's time to talk to yourself, talk to your body, to know your body. Okay, an opportunity of knowing what's more important in life, and the opportunity of knowing time is limited. Because we think, okay, it's ongoing and I'm going to live forever, and I'm going to delay my treatment or the healing process or whatever. I'm not going to change my diet. I am not going to change my lifestyle. When I see people who are close to 50 years old, I tell them, well, you finished your half of your game, you have a second half coming. And if you have this medical condition, you need to change your lifestyle. It's a second half of your life. It's your opportunity to live a different life, to make you stay healthy. Because your lifestyle and your eating habits and so on probably created this type of physical condition. Therefore, it's time to change your lifestyle, your diet, and your mentality. Okay, so in conclusion, I like to go over a little bit, what I talked about. Now is the best time to heal. So now it's the time. when I treat my patient, I tell my patients, I don't treat your past, I don't treat your future. I will treat you now. Tell me what's going on now. So you ask yourself now, what is going on now that I can change and I could improve my health. Unless you are a licensed physician or healthcare provider, you don't want to diagnose, treat, cure, or prevent any disease with healthcare products. However, like I said, you can add some of the symptoms, and you don't go directly into diagnosis. So when you hear the diagnosis, you stand back, and then you ask, you listen carefully, and about their complaints. You know, some people will say, "Oh, you know, I have anxiety, I have a depression, or I have bowel issues. You know, I have constipation, or I have a muscle spasms at night. You know, I cannot sleep because of this muscle spasm." And by the way, this calcium magnesium 2-to-1 ratio balanced, this also can help the muscle spasms, but also can help your sleeping. And there is another symptom that I hear a lot nowadays is restless leg syndrome. What is a restless leg syndrome? You don't know what's going on. You know, you feel like your leg is doing, you know, whatever it wants to do. You know, you feel like you're separated from your leg. The leg is moving or shaking, or, you know, having unease feeling. That is called a restless leg syndrome. The vitamin, the calcium, magnesium also can help at that kind of condition. B6 and other vitamin B complex could help, and the bowel movement, it's a daily thing. Okay, so that's all, and the next screen has nothing to do with today's topic. However, I like what he said. So I would like to share with you details. So this phrase was, he gave the graduation speech at Stanford graduation. He said, your time is limited, so don't waste it living someone else's life. In order for you to fulfill your purpose, the world needs you to be who you are. Trying to copy someone else or act like somebody else, you'll will only limit your contribution. So you are limit your contribution to the world. So you are very unique, and you're as precious as anybody else in life. So treat yourself right now. Now is the best time to heal. Thank you very much. That's all for today.
All right. Thank you very much. Let's give Dr. Sway a hand, everybody. All right. Outstanding. Great information. All right. Let's see. We're going to open it up for questions. If you have a question, please raise your hand. Tell us who you are, and you can also tell us where you're calling from. Are any questions for Dr. Sway at this current time? Yes, I got iPhone 91. Unmute and give us your name, please. The person that raised your hand, there you go.
I meant to give him a pause for thank you for the presentation. It's wonderful. This is Kim, and I didn't mean to raise my hand. I meant to give him a clapping of thank you for the presentation, and greatly appreciate him.
Okay.
That's
all
it.
right.
Mhm.
Okay. Well, thank you very much. And Dr. Swade definitely appreciates your appreciation. Okay. I see Keith Jordan. Keith, talk to us.
Yes, sir. Dr. Sway, you said two probiotics and two psyllium husks in the same bottle at the same time or two different times?
Same bottle, same time. You can mix them together. They'll melt in the
Okay.
water.
Okay, all four of them. Okay. Thank you.
Welcome.
All right. Thank you very much. Good question, Keith. There is a question in the chat. It says, hi, Dr. Swade. Atomy, does Atomy have B6 alone or just the B complex? Okay.
We don't have a B6 alone, but we have B complex. And also, like I said, the hemohim has a B6, rhodiola, milk thistle also has a B6, noni juice has a B6, and spirulina has a B6.
Okay.
So
So all,
spirulina, the difference from other the B6, the combination formulas, spirulina also has a detox function. So it not only nourishes the body, but also detoxes our body, especially the heavy metal.
okay. Also, she said, you mentioned high dose. About what unit is considered a high dose? Thanks.
I don't remember. I mentioned high dose. The safest way is to follow what the label recommends. However, if you have symptoms of vitamin B6 deficiency, then you could take a little extra. And if you combine with let's say you take 1 shot of noni juice in the morning, and then after breakfast you had the hemohim, and in the middle of the day you are stressed, so you took the rhodiola milk thistle, then I think you have a plenty.
Okay. Okay, I see that we have Maggie has her hand up. Maggie?
Yes, thank you, Uncle Mike. Thank you so much, Dr. Sway. My question in regards to supplements. I know that they said, which supplement would you not recommend taking together? There is a doctor I follow. She said vitamin D, I think it's a D, and calcium should not be taken at the same time. Is that true?
Well, the calcium is a little tricky because the calcium can neutralize your stomach acid. So sometimes if you have a stomach acid deficiency, some people will feel a little heartburn or indigestion. The Tums and some of the anti-acid medications are all calcium based. So that means it actually lowers or it bring up your pH level, less acid. So sometimes maybe you want to take with the meal calcium, and then other vitamins after the meal.
Okay,
Mhm.
thank you.
Yeah.
And in regards to magnesium and calcium, maybe I missed your thing is there supplements that Almi has that has, I know magnesium in the multivitamin one, but the other one that you mentioned earlier, there's all vitamin B6.
Yeah, so our plant-based calcium has magnesium in it.
I see, okay.
So it's that one formula is complete. It's a 2-to-1 ratio, has a vitamin D and vitamin K. Everything is in it.
Thank you.
You're welcome.
Okay, let's see. Okay, S. Tang says, hi, Dr. Sway. What would you recommend someone with high platelets and macular edema?
So this is a very good example. And we don't want to get involved with that. Because first of all, it's a medical terminology, medical term, it's a diagnosis. And we don't deal with the diagnosis. You should ask what makes you don't feel good. We go from there, right? You know, what makes you don't feel good every day? You know, instead of, oh, you know, maybe heme can help you. No. So that means you are actually playing a doctor. It's like playing God, playing doctor. If you're not licensed, a physician, you don't want to, you know, you don't want to go in there. You don't want to get involved with that. Okay, so macular, whatever, no. So like I said, be patient with your client and talk a little more, have little more conversation, right? And you know, your client will tell you, oh, I feel tired all the time. I feel dizzy. You know, I have no energy. I have poor digestion. I don't have, you know, bowel movement. I have muscle spasms. Then you could recommend some of the supplements, but we don't say, okay, this product or that product is doing this or that. Hopefully I answered your question.
Okay. Diamond Master Maria Ramirez says, I thought you can't take 2 selenium husks at the same time because you could choke.
I don't know if you've taken other type of psyllium husk. I don't know if you tried the 2 or even 3. I bet you haven't tried it yet because I tried the 3. I haven't, nothing happened. I didn't choke. I swallowed okay. Don't wait until like you get you know, all jammed together. You know, if you wait 30 minutes, I guarantee you might choke. Don't do that. So as soon as you put into the water, you shake it, you drink right away. You are not going to choke even 3 psyllium husk. Okay. And psyllium husk, I don't know if you tried other type of psyllium husk, you know, you see more thickness, you know. But this one, even you leave like a 10 minutes, it's still liquidy, right? So I don't think you will have the problem. It's not just me. I don't know if you remember from one day seminar, Juyong Park, he came and he mentioned about, you know, the CEO Park. He likes to take 2 of them every day, 3 times a day. And he just loves it, right? And Juyong Park, he just start following him. He also takes 2-3 times a day. No problem, and he loves his bowel movement.
Mm-hmm. So Maria, the key thing on the choking, I think I remember a call we had. The key thing is that you want to make sure that you drink plenty of water when you take the selenium husk. That's the key thing.
Yeah, that's for sure. I don't know if you know colonics. Colonics is, you know, you clean the intestine. They put the holes into your system and then, you know, get all the you know, bowels come out of your system. That's called colonics. So it's almost like we're having colonics, right? You know, after you take a psyllium husk with probiotics and enzyme, it's almost like you are having colonics. You know, but you have to drink lots of water. The water is very important. It's almost like, you know, you soaped yourself and you know, you're ready to rinse out and you have no water. So if you don't drink enough water, then it's going to be like that in your system, in your intestines.
Okay, all right. Mr. Ping.
Thank you, Dr. Mike. Uncle Mike, thank you. Dr. Sui, thank you very much again. I just want to testify about this, the gas formula. So I had the chance to bring home the psyllium husk, a gift from the North Carolina Global. And I tried this to my 86-year-old father who has diverticulitis.
Mhm.
And he's been suffering for more than 20 years about that, pains and everything. And I have an 83-year-old mother. I won't mention anything, the incidents, and the accidents happening. So both of them, I call it toilet problems. So and now I found out about the formula, but still, I just gave them, they directly put it in their mouth. But you know what happened? I can testify this with you. It works a lot. And now I know that I have to mix it in the water, not just by giving them. But I tell you, for now, my father I still check them, even not complaining anymore, having this gas pain, this pain every time we call. It works a lot. It works a lot, this formula. So I recommend to try it, and it will work a lot, especially to like very old people that we have in the family. Okay. So secondly, yeah, still the same, Dr. Sui, the things that I've learned from you about healing and opportunity. So this is the thing that until now, I'm still carrying it. The opportunity to oneself to learn, the opportunity to learn our body, and knowing the time to heal and to manage our diseases. But what it helps me now, being an Atomian, is to have a regimen using our Atomy as supplements. So it's more. Thank you very much again. It's a very wonderful presentation today, Dr. Sui. It helps us a lot. Thank you, thank you, thank you. 100 times.
Mhm. Yeah, I lived in Central America for 9 years, and I had amoeba infection for 4 times a year. And as you know, amoeba infection is a serious condition. You have diarrhea 24/7. You have a diarrhea like 9 times a day. And then I took psyllium husk. It start to push all those bacteria out of your body naturally. Yeah. And so if you take a psyllium husk, it will stop your diarrhea.
Correct. Agree.
Yeah.
Agree very
So
well.
psyllium husk is not just for the stomach movement, bowels or constipation. It can also help diarrhea.
Agree with
Right.
that. I very much agree, because I'm a person because I'm diabetic, I always have diarrhea. And especially when I go home and I live in the island and we talk about amoeba and water. I experienced once, but taking the psyllium husk, it helps me a lot.
Yeah.
And the fine side.
Mm-hmm.
And taking, over-the-counter diet, like medicine, sorry to say, it irritates you, and I can feel like irritation, but thank you. I don't want to kill your time. Thank you.
No, not at all. Yeah, so the psyllium husk, why it's different from other products out there in the market. I found that this is a very soft, or it's a very fine psyllium husk. It's not as rough as other psyllium husk in the market.
Having diarrhea is not even taking too long to be effective to you. Not even 30 minutes, less than 30 minutes, it's effective. I was traveling miles and miles and it works. Yeah. Thank you. That's the best thing.
Yeah.
All right. Thank you very much for sharing that information, Mr. Ping. And just to reiterate, the reason why you have to take or drink a lot of water with selenium husk is because it expands. I'm not sure if it's 40 times, it's something like that. It's in your back office. So that's the reason why. So that's why the question came up probably about the choking. If you take it without water, then you could choke. Okay. So just to reiterate, it's very important to drink a lot of water with your selenium husk.
Oh, yeah. A choke. Okay, so I got it. If you if you take it without the water, you put into the mouth without mixing with the water in advance, then definitely you will choke because it's very dry, So you don't want to do that. You put into the water and shake it and then drink.
Okay, thank you. All right, now, let's see. Okay, in the chat, Phyllis Johnson, is it best to take the vitamins at night before bed so they can be broken down and be absorbed into the bloodstream quickly and when you get up?
Well, I like to take whenever I remember, first of all, because a lot of people don't remember to take your vitamins. So it's better that you place where you can see. You know, if you don't see, you forget. That's second, and I like to take my B vitamin in the morning after the breakfast. I've tried before the meal. I feel a little dizzy, not dizzy, little nauseous, and I feel better after the breakfast. So that's my experience. And the vitamins at night, I will take a calcium, magnesium with a dinner time. Otherwise, vitamin C, I like to take it during the day because that's when I need my energy the most. When I'm sleeping, I'm sleeping. I want to sleep better. I don't want to have too much energy at night. Sometimes wake me up. So I like to take those the formulas, supplements give me energy during the day. And at night, probably I like to take the iLutin, eye health at night to help my eyes at night. Otherwise, I take most of the supplements during the day.
All right, thank you. Okay, we have Dr. Sis. Dr. Sis.
Good evening, everyone, and good morning all around the world. I do not have any questions for Dr. Sway, but I just wanted to tell everybody that he is my hero. He literally saved me from a terrible, terrible pain. So I would like to thank him for his for always sharing his talent to us, sharing his time to us. But at the same time, I would like to tell everyone, wherever you are, it is worth the trip going to see him, because really, it was like amazing. I went there walking hunchback, and I left his office walking straight. And my husband was like, "Are you kidding me?" It's like he says, "I think you were pulling my leg. You were having pain." I said, "For 3 days, I was having pain and I was just pulling your leg? Come on." But this is no exaggeration. I went to his office, I was miserable. So wherever you are, it is worth the trip going to see Dr. Sway. Dr. Sway, thank you very much. I thought, I said, I cannot let the Zoom meeting finish without really saying in public how grateful I am with what you have done. So amazing. Thank you so much, Dr. Sway.
Thank you.
All right, thank you very much, Dr. Sess. Okay, there are two things in the chat. First is going to be from Berna. It was mentioned that HemoHim also acts as a blood thinner. If someone is currently taking blood thinner, is there a way they can still have our HemoHim?
So HemoHim is it can make a blood thinner, make the blood more thinner. That it can be correct. Therefore, you need to be careful or cautious. However, you don't have to be in fear or worry that you take HemoHim. My recommendation is that you don't want to take your medicated or prescription medication at the same time. Okay, so if you're taking blood thinner in the morning then after 2 hours apart, you can try Hemohim. And see and ask yourself, always communicate with yourself. Ask yourself, how do I feel? Do I feel more energy? Do I feel anxious? Do I feel palpitation? You ask yourself. The blood thinner is a very strong medication, and it's prescribed for heart attack, stroke patients, and any incidents with heart. So doctor wants to make sure that your blood flow is normal. That's why they prescribe blood thinner. But you also ask, instead of just to say, oh, take this, right? You ask the patient or your client, how's your energy level? You see, if they say, oh, my energy level is great, and don't force yourself, okay, try Hemohim. Okay, but most of the time they have a low energy for sure. Yeah, so you can recommend the blood thinner, not even the Hemohim, but they also the aspirins need to be careful also, right? So some people are taking a blood thinner and the aspirin. You see? Yeah. So be cautious, but you need to be, the client has to be in charge of their body. They need to communicate with their body and to see if they feel worse or better, or feel good. Okay.
All right, and then our last one from the chat is from iPhone. What could be the cause of boils coming up on various parts of a female body?
The boils, that is, it can be bacterial, right? Boils can be bacterial. In Chinese medicine, we say it has to do with the heat toxin. The boils were very popular during like the 60s in Korea, actually. And for those Koreans, you will know if I mention this one medicine, it's called koyak. So koyak is number one. The patch to draw the pus out of the boils, it's a very good medicine. Actually, it's the medicine was first introduced in Japan. That is a koyak, right? The boils, it can be bacteria, but try not to take antibiotics, because antibiotics sometimes make your boil harder, harder to come out. They need to come out. Sometimes they come out of your skin. So I would recommend, if check your bowel movement, and make sure you have bowel movements every day, because a large intestine, Chinese medicine, is connected to your lungs, and lungs are connected to your skin, right? And this boils, sometimes it's not just at the skin level, but also muscle layer, so when you squeeze out the pus, and sometimes you'll see big hole in your skin, that's because it went down to almost to the muscle layer. Yeah. So if the boils, under the armpit, I see there some patients, they have this condition under the armpit. It has a big boil, and then it's connected to, all other parts of the body from the armpit. Yeah, so that's, I would use, a detox formulas, something like I mentioned the spirulina, right? And also gas X formula. We have, there are many ways to detox our body through your bowel movement, through your urination, and through your perspiration. You sweat out all the toxins out of your body. But if you want to detox your body inside out, inside you can use some of the formulas to reduce the toxins. And also, I recommend that you don't eat any spicy and oily food. No chicken wings, no chicken wings and beer. I guarantee that the boils will burst out if you have chicken wings and the beer at night. And also the chicken wings and the beer, just as mentioned the chicken wings and beer, if you have a gout, avoid chicken wings and the beer or sausages and and the beer. Then I guarantee that you're going to have a gout pain in the morning. Hopefully I answered your question.
All right, that was great. And then another thing here from the question from Phyllis Johnson: is excessive face sweating anything to be concerned about?
Well, it's a normal. It's a hot in Atlanta, and I'm sure the North Carolina is it's almost the same. It's a very hot. It's normal if you go out in a hot day. You sweat out. It's normal. And some people sweat only in the head. There's some heart conditions could cause that. But the babies have a lot of sweating in their hair, in their scalp. They don't have any heart problem. So don't think they are the abnormal. If you sweat, like night sweats are different. Night sweats, you have a different condition. Night sweats, you better talk to your physician or the Chinese doctors. They know how to deal with the night sweats. And also spontaneous sweating. That means you just move a little bit, you sweat, and you feel very tired. You feel like you want to faint, right? So that's the spontaneous sweating. So those type of sweating is due to the energy deficient. We call it qi deficiency. Then you can also talk to a Chinese herbalist to help with that. And Hemohim could help with that kind of condition, right? Hemohim could help your energy level, to improve your immunity. And excessive sweating, other than those two conditions, you don't have to worry about. You just keep yourself cool and drink lots of water and electrolytes. So maybe it's safe to have 5-6 ounces of noni juice with lots of water and shake it and drink it. That will help you.
Okay, one last thing here is from Helen Wu. Is the Hemohim good for eczema?
Hemohim good for eczema. Again, eczema is a medical condition. We don't diagnose, treat, or cure any of the medical conditions. Okay, so you have to ask the patient if the patient has a low energy or constipation or any immune deficiency or autoimmune disease. That's another medical term, but why I mentioned autoimmune disease, because eczema, it could be autoimmune condition. The body is overreacting to the stimulants. So that is eczema. So there's some testimonials, after taking Hemohim, eczema got better, right? And some people have eczema, drink Hemohim, didn't get better. So what's going on? Some people get better, some people don't. Then don't say, oh, some people got better, so try this, for eczema. That's very dangerous if you do that, So you can borrow the testimonials, but you don't want to claim it. That's another thing. You can say, oh, some people tried, they, especially those, the teenagers or the kids, they have a severe eczema, in the elbow, in the knee, and then after taking Hemohim, they all got better, right? That's great testimonials. But still, you cannot say, Hemohim will treat your eczema. Hopefully, I answered your question. But if I have eczema, I would love to try my Hemohim.
All right, great. Now, Kathy Porter asks, is it a concern if an individual does not sweat at all?
Well, it's not a concern, believe it or not, you don't sweat like other people, but you do sweat. You see? Yeah. Some people are sweat like, wet towel. You can squeeze and then you can squeeze out more water. When I touch the patient, wow, this patient is very strange. Half of the body is sweating and half is not sweating. She came for treatment. So I said, wow, this is very strange. When I touch, half the body is sweating like crazy and half of the body is dry. So she's been to lots of dermatologists and lots of doctors. And when I put the needles, treat her, and I come back after 30 minutes, it's all dried up. Believe it or not, it's all dried. So not sweating is not really the problem. However, if you want to sweat out a little bit, and if you want to, detox your body through the sweating, the safest way is that you walk fast or run. And if you don't have any, anemia, or then you can try the Hasana. You can try Hasana to sweat out a little bit. And I have a lot of patients are doing hot yoga nowadays. Hot yoga, personally, I don't really recommend hot yoga because they sweat too much. You see, they sweat like almost every day, or every other day. Whenever they go to hot yoga to sweat out, they feel better though afterwards. However, you need to replenish with electrolytes and the water, and you need to watch also. To sweat out too much, sometimes it can damage your yin. In Chinese medicine, there are yin and yang, or yin and yang. It could damage yin of your body if you sweat too much. And we, in Chinese medicine, we call the sweat and the blood are from the same source. You see? Yeah. So if you sweat too much, it's almost like you're bleeding. Do you remember in the Bible that Jesus, the sweat out and the sweat like a blood? It's real. If you sweat out like that, it can be like the blood. Okay.
All right. Thank you very much. Before we close out, I'm going to see if our Royal Master Yusuk Sung would like to have some closing words.
Good evening, everyone. Wow. Oh, Dr. C, he is our hero. Today, more than 100 people packed this Zoom meeting. Thank you very much. He's very famous and busy doctor. Today is a special time for us. Thanks for sharing your knowledge. Great teaching us. Thank you very much. And we are so blessed people all. We have a great product from the Atomy daily supplement, and we have a great doctor in our group. He teaching us how to handle new people. We are not doctor. We are not medical specialist. That's why we need to be careful. No over exaggeration. He's teaching us how to say, yeah, the energy or how feeling, we can touch it that way. No, healing, curing, don't use that kind of a word. So thank you very much, Dr. Sui.